Thank you, Honorable Minister of State for Health. We take the DG NCDC.
Chair, members of the Presidential Task Force, ladies and gentlemen of the press. This morning, there's no other issue that is probably on the forefront of your ideas other than the situation in Kano. So we've decided to take this head on. There's been a lot of conversation about the situation in Kano. But first, I'd like to remember that remind everyone during a pandemic, the risk of spread is in those towns where the population density is the highest. We understand, we're all aware of the population density in Kano, so Kano has always been very high on our radar. So the high number of cases that we're now seeing in Kano is really not a surprise. We're very concerned about this. We're very concerned about this, and we're doing everything we can. Now, despite our strong commitment to quickly control the spread of the coronavirus, there's no magic bullet. There's no magic bullet. If anyone has one, I'll be happy to get it. But as much as there's been this conversation, our role is to continue to work very hard. Work very hard on behalf of everyone. Work very hard for the people of Kano and the people of every state in the country. So what exactly are we doing? Now, firstly is to mention that, Kano has been one of the states with which we've had the strongest relationship with at NCDC. There's no single state I've visited more often since I became the DG in 2016 than Kano. So we have a strong relationship with the public health leadership, with the commissioners, and we've had over the past few years. And again, just last week I visited with Kano State and met His Excellency, the Executive Governor of Kano State, Dr. Abdullahi Umar Ganduje. And we had very fruitful discussions, very open, very fruitful, in recognition of the difficulties in Kano and a commitment to continue supporting. Now, within the first 12 hours of the first confirmed case, we had already deployed a national response team to Kano to support the state government's effort. We now have a total of 15 people in Kano, and we will continue scaling the number of people supporting Kano State until we get to the appropriate number. Just maybe 10 days ago, I announced the activation of the lab in the Aminu Kano Teaching Hospital. We did everything possible very quickly to activate this lab to reduce the turnaround time for the testing of samples. But sometimes speed also has consequences. And in this particular case, unfortunately, we had an incident where the lab was contaminated and biosafety measures had to be strengthened. So in the interest of all the healthcare workers in Kano, especially in AKTH, we had to pause and shut down that lab for a few days. And that is exactly what we did. So we've been working together with people, with our colleagues, to reactivate this lab, but we have to do this safely. In the last 72 hours, we sent another team from the National Reference Lab of the Nigeria CDC. They have worked day and night over the weekend to reactivate that lab, and I'm happy to announce that that lab will start working this afternoon and start testing samples again as they should be. This has not been an easy effort by any stretch of imagination. It has taken the collective effort of my team, the laboratory scientists in Kano, colleagues that we have recruited in an ad hoc way, and many people that have quietly worked on this to make it happen. We will not stop till the lab is fully functional again. We're also working with a new lab in Bayero University, Kano, so that we have two labs working concurrently in Kano. So right now, everybody is working very hard to get the lab working because we are very aware that the lab really is the window into the response. So we remain focused on our targets. Our focus this week is to rapidly scale testing across the country. And I'm happy to announce that in addition to Kano, today we're activating the high throughput Roche machine in the National Reference Lab that will enable us an extra capacity of about 1,000 samples a day, if we can get the samples in. So we're working to get in the samples from across the country. We're also working very hard to investigate the causes of the deaths that have been reported. Now, mortality surveillance is not easy. So we're working to do what we call a verbal autopsy retrospectively and prospectively, together with the public health team in Kano. That is very diligent work that is going on at the moment, and in a few days or a week we'll be able to produce the initial results. We continue to work in collaboration with the Kano state government and recognize the strong leadership of the state. These are difficult times. People have lost loved ones, families have lost loved ones, and businesses have closed. So we understand the difficulty being faced and the challenge and the anxiety. But we will not stop till they get to the bottom of this. So our philosophy at NCDC has always been to consider the states in Nigeria as our primary clients. No states, the bigger states for the work that we do, always pose specific challenges, and we therefore have to put in extra resources to them. We will continue to work very hard, recognizing that there's no magic bullet to solve this problem. It will take more time, stronger collaboration and support from all of you. Our work is to put our heads down and continue. We will not be distracted by any politics, any insinuations. We will continue supporting the people of Kano and the government of Kano State to get ahead of this. This is a time for collaboration. This is a time for leadership. This is a time for solidarity. It's not a time to point fingers. Our work is cut out for us, but we're not running away. We remain committed to achieve the task that we've set out for ourselves. We recognize it's a marathon, not a sprint, and we are committed to the mandate given to us at the Nigeria Center for Disease Control. Thank you very much.